I need to update the last video that I did. This particular video is just following a primary care visit with my personal medical home physician that I so much enjoy. I've had this man for a few years, and he is trained in integrative medicine and does his most to help me. In fact, he's even called me on Saturday mornings to give me a bit of a talk to raise my spirits when I was down, and that's true excellent primary care. It's the kind of care we used to have back in the 60s and 70s and even early 80s, before we became aware of how much healthcare was costing us and profit margins were falling and all sorts of business of medicine changes occurred. I want to just refer to the fact that the visit that I just attended and led, actually, as the patient, was 30 minutes late. I get kicked out of the office if I'm 15 minutes late myself and get asked to reschedule. He was late because the doctor was performing referrals that required a lot of documentation, and he even has a documentation assistant. When my physician entered the room, he was so frazzled that he had to walk back out and finish some other business that he was doing and then come back in and sit down and start a dialogue with me. And I had given the reason for the visit, which was a follow-up, and he had not obviously read the notes that were taken by the medical assistant prior to the visit. And as he was running down the problem list, he looked up at me and he asked whether or not I had type 1 diabetes. And that indicated to me that he was in way overstressed, because the guy's been taking care of me for years. And I've had diabetes since 1966, so that's roughly, 51 years now, going on 52. So that tells me that the doc can't do the best that he can for me in terms of integrating my services, because he's not even operating with a full deck because of his stress level. We then went through my meds, we corrected the diagnoses, and the guy had to stop 3 or 4 times to work with the electronic health record with the records documenter, whatever that position is. This was not a nurse, this was a person facilitating the documentation, to make sure the codes aligned properly with the lab tests. What that means is whatever they're looking at for a diagnosis, the lab test has to be justified by the diagnosis. Makes sense, that way we don't get things ordered for us that aren't necessary. Brings down the cost of medicine over the long and the short term. But in reality, what most folks need to realize is that our doctors today that we see have been trained post-managed care. That means after the 1980s, early 1980s, when managed care took off and started to reduce the cost of the inflation of care in our country. The doctors that came out of school learned these systems forward and backwards. They were learned not to order things that were not necessary. When pressured to order things by their administrations later on, they in fact stopped doing so. I have a friend that actually left his practice because he felt overpressured because of that factor. So doctors working efficiently today, I think they know how to do that, but our systems are still pushing them to document and fill the right fields in, and that's slowing up the process of getting the information from the patient with integrity and clarity, and with accuracy that is necessary for them to do the diagnosis in the event that something's happening in the visit at the moment. So that being said, these guys are overworked, overstressed. They're not getting the right information out of us. They're spending too much time looking at what to record when to make sure that revenues are maximized or not denied by the carrier. And we're not seeing right care in the right place at the right time. We're seeing the right people, not at the right time, as I told you earlier. I think I'm in the right place. I'm in a multi-specialty practice. But it's not the right care because the guy can't process the info because of the documentation stress. There's a lot more that can be cut out of the system and systematized with both technologies and just a change in philosophy. Get the business of medicine to look at itself clearly, and let's get together as a nation, go to universal coverage so that everybody's covered, so nobody has to worry about whether or not they can get to the doctor for the needs that they have, reduce the cost of treating people in the emergency room, and make a contribution as patients ourselves to work with our clinics and making these changes as they happen. I don't know how many generations it's going to take to do this, because the business of medicine tends to overwhelm us, but I'm one for getting it right-sized and putting the patient first. It's us and our doctors. Move forward for right care now. God bless you all and have a great weekend.